Welcome to the American Med Spa Association podcast, Medical Spa Insider. This week, AmSpa founder Alex Thiersch is speaking with Keetha Hanlin, RN, LME, Senior Clinical Advisor at Methapharm.
All right, welcome everybody. Alex Thiersch, welcome to Medical Spa Insider. And today on the AmSpa hotline, I am very pleased to have Keetha Hanlin, who is an RN, as well as the Senior Clinical Advisor for Methapharm, which is a distributor for Asclera. And so we're talking about sclerotherapy today. And I want to say it's like spider veins, varicose veins is what it treats. And it's something that I think a lot of med spas maybe are either overlooking as far as adding it to their practice or maybe not doing it in exactly the right way. But I'm super excited to learn more about this. To be honest, I don't know too much about spider veins, varicose veins, or their treatments, nor do I know a lot about kind of the economics behind it. But it's going to be exciting to talk to Keetha about this. First of all, Keetha, welcome to the program. Appreciate you joining us.
Thank you. Thank you so much for having me. I really appreciate it.
Yeah, no, of course. So I have a lot of questions, but first, let's just talk about the product Asclera and sclerotherapy. Like most people probably who are clinicians listening to this are going to know of it and know the treatments, but just kind of give an overview of what it is and what your product is. And then I would love to also get a little information about kind of how you got into this as well.
Okay, absolutely. So as you stated, we distribute Asclera in the United States market. There are actually 2 FDA-approved sclerosing agents in the United States. Obviously, we're one of them. The other one that's out there is STS, Sotradecol. Those are kind of brand names, and then the generic name is sodium tetradecyl sulfate, which is a bit of a time. Yeah, exactly. And so anyway, so yes, there's 2 FDA-approved sclerosing agents here in the United States market. Obviously, I work primarily with Asclera, and what that medication does is once it's injected into a vein, it's treating that vein, the unsightly vein, whether it's a spider vein and or a reticular vein. It's treating it so it cannot be seen any longer, because most of these clients or patients are coming in, and saying, hey, I've got this vein right here. How do I get rid of it? And so injecting Asclera inside of that vein will help minimize it, get rid of it, don't need it because it's not working properly anyway. When you can see those unsightly veins on the legs, the valves inside of those veins are not really working so great any longer. Mm-hmm. So what it's doing is pulling the blood towards the feet, dilating those blood vessels, and that's when you can see, when the patients can see those veins. So if we inject a sclerosant agent, which is almost acting like a detergent inside of the vein, what it does is it irritates the inner lining of the vessel. It shuts it down. Mm-hmm. It creates a fibrotic cord, and then the body metabolizes that, and then you can no longer see that vessel. So it's a very simple process in terms of what to do. Now, in terms of the injecting technique, mm-hmm. That's where most practitioners, they either struggle when they're first learning, or it can be somewhat of a challenge. So training is key. So
and this is probably just me, I'm a lawyer and definitely not a clinician, but I'm curious, so forgive me for those of you who know the answer to this already. The body metabolizes it. So the vein that is injected, the reaction causes it to be metabolized, so shut down. The blood that was going through that vein, does it just get rerouted to another area? Like, how does that work, just kind of clinically and anatomically?
Absolutely. Okay. We've got so many veins, vessels all throughout our body, obviously. And when one gets shut down, it sometimes can reuptake and flow into another vessel. And especially if you're somebody that this is a question that, I ask people when they come into my own office is, do you have a history of veins in your family? Did your mother, did your father, did they ever have their veins treated? Is this something that they have? I ask about, past pregnancy, smoking, aging, obviously, obesity, any kind of sun exposure. All of those things factor into, what's happening in the legs. So if I know that information, then I can communicate to the patient, hey, if this is something that, you're seeing your family, if there's something familial there, then this might be something that you're, kind of dealing with, or you need to be managing throughout the years. So if it's just like a one-off vein that you're treating and you're injecting it, goes away, there's no familiar history, you're good to go. But if I hear from patients that, they might have further or extensive vein management that needs to happen, I'll communicate that with them. Those veins might reroute themselves and, uptake again.
So let's talk about medical spas, because that's obviously our audience. There's a lot of folks who are run medical spas or are looking to get into it. A lot of people are looking for ways to differentiate themselves. I was researching this prior to the podcast, and to me, like, one of the things that I think is happening is, med spas are always evolving to figure out what else they can treat. It's more of a whole body thing. We're really getting into the whole body wellness. And to me, this fits kind of right into that. I would love to know, what's the popularity thus far with med spa? Who's your kind of common customer when it comes to medical spas? What types of practices do they have? Because it seems to me, with the aesthetic side on the legs, you've got the ability to treat it potentially with lasers. This is another option, and I think I would love to know kind of who actually is the kind of the prime candidate for this product.
As far as practitioner is concerned?
Yeah.
Okay. Yep. So medical spa, dermatology, plastic surgery, those for us, in our company, those are our largest base customers or practitioners that are injecting, and then the vein clinics that are out there. So they're primarily doing it.
Yeah. Yeah. Is it, what's the what's the popularity with med spas? Why is it a good fit for med spas? If you could talk to that, like, what's the reason to kind of bring it in other than what I've already mentioned?
Yep. So the gold standard for treatment of these spider veins and reticular veins is sclerotherapy. It's all through textbooks. Something in my own office, I think it's great when you have, especially a med spa, and I know a lot of the derm practices and plastic surgery offices, they kind of have that gestalt of, of treatments. We can use this and we can use that, and it's a full comprehensive treatment. I think it's so important that you have the ability to offer that to your patients and your clients. So if you've got, let's say, a 1064 ND gag in your practice, and you have only been treating veins with that laser, you're doing your patients or clients a little bit of a disservice, because if the gold standard is sclerotherapy, if you can get a needle into a vein, you should be injecting it first. The YAG should be your number two go-to in terms of how you're going to approach that patient, how you're going to treat that patient, and what is the most effective way to take care of those veins. Otherwise, you're just going to keep chasing those veins with the laser. And from what patients have communicated to me when they've gone to other places and they've only been treated with a laser, aesthetic laser, is that it hurt really bad and the vein did not go away. And then I can educate the patient by stating, sclerotherapy really is the gold standard. We'll start with this, and then if I need to, clean up anything, I'll use a laser after that.
Makes sense. It seems like a kind of a logical add-on. You mentioned a few things that I want to follow up. One was the injection technique. I think you said people sometimes struggle with the kind of the training aspect. That's the biggest part where you have to worry about is with the training. Talk about that. Like if I'm a med spa provider out there and I want to add this to my practice, what's the training regimen? How do I get that on board? How long does it take? That sort of thing.
Yep, absolutely. There are training facilities out there across the country. You know, we recommend a couple of them that I've kind of vetted out to see, you know, which ones I feel give a very comprehensive training program. One that, you know, I think is necessary is hands-on training, because I get most calls from practitioners saying, hey, is there any way that you could come into my office and help me with the hands-on, portion of this?
Mm-hmm.
And that's something that, you know, I do not do any longer, but going to a course, you know, a weekend course where there's didactic and then there is a hands-on component, and then getting back to your, you know, practice and bringing in your friends and family to practice on before you're actually, you know, bringing in the masses to charge them, I think it's a very wise thing to do, because there is a technique skill to this procedure. And so you can't just watch a YouTube video and figure this out, because there's the skill set hands-on, but then also understanding vascular anatomy and the vein system, the vascular system is really crucial.
Are there potential complications or side effects that folks need to watch out for? And how do you prevent against that with pre-screening consultations, things like that?
Yeah, there's some complications that can occur, rare. There is something that's called staining. There is something called matting. Their worst case scenario, it's very, very, very rare that a patient could get a small ulcer. And that the ulcer component is really based off of the skill set, and then also the concentration of sclerosant that is utilized in that vessel. It could be potentially too strong. So, you know, when you're talking about those types of complications, you know, in a cosmetic world, when you think about staining or hyperpigmentation. So, you know, if you have a client or a patient that comes in and they're coming in for veins, they get injected and they're thinking, I'm going to get my veins taken care of. And then they come back to you 2 weeks later and they've got hyperpigmentation on their legs or staining. That is not something that you want to, you know, have to deal with. So again, just going back to proper training, proper technique is crucial to avoid those potential complications. And then also using an FDA approved sclerosant. You know, when you've got that FDA approved sclerosant, that's your safety net, right? So you've got that indication that's provided in the product insert that says, hey, you know, Asclera 0.5% is used for, you know, vessels that are 1 millimeter in diameter and less, or, you know, Asclera 1% for veins 1 to 3 millimeters in diameter. So staying on your product insert, really with any product that you're utilizing, right? Familiarize yourself with those product inserts, because I cannot tell you how many phone calls our customer service gets, and then I get inquiries from practitioners that never even open that up and educate themselves on what you're injecting into people, whether it's, you know, whether it's with sclerotherapy or Botox or any of the filler. Like, it's so important for us practitioners to be responsible and know what we're putting in our patients and what the indication really is for.
Yeah, absolutely. What's how long does the procedure take? And is it painful? And how does that work?
Most practitioners will take anywhere from 15 minutes to 30 minutes to inject. If they really want to go for it, sometimes, you know, they'll keep a patient for up to an hour.
Okay.
You know, it's a lot of tiny little needle sticks. I mean, the needles are typically pretty small, about a 30 gauge 1/2 inch needle or a 27 gauge 1/2 inch needle, just depending upon what size vein you're injecting. So, and it just varies what a practitioner feels like doing. And that's basically the cost. A lot of times the practitioners will associate the cost with time or time with cost and vice versa.
Right. Well, yeah, and that's kind of what I'm kind of thinking about. So you've got like a med spa who has, let's say they have a laser like you talked about, and they're thinking about adding this. How does that how do you recommend that they kind of build this into their practice? Because some of them I imagine are going to be anxious to first kind of go with the laser, because to me it's like they think it's going to be more powerful. Using the sclerotherapy, I think, is like, as you mentioned, it's the gold standard. It's a better option. How do you get folks to start considering building this in? Are there specific protocols, specific techniques that you use as far as the sales tactic? Most med spas are all cash as well, so they're not hooked up with insurance. How easy is it to add this to your practice?
Very easy. We have people doing it obviously on the daily, but I like to recommend packages, like doing vein packages, especially. I know there's a lot of memberships out there.
Yeah.
I have memberships. It's one of the line items that you can choose from in a membership, sclerotherapy. And a lot of times people will even ask about it in terms of sessions. So I think it's very simple to add in. I don't think that I've spoken to any practice across the country, that I've worked with that, had a difficult time, having patients sign up for sclerotherapy.
Yeah. You mentioned earlier that if a practice maybe has, I think you said a YAG laser, and then is adding, or is not offering sclerotherapy, that they may be doing their patient a disservice. How do they kind of line up as far as efficacy, right? Like what the actual, do you tend to see, in your view, better results from this than you do from the laser treatment?
Absolutely. Much more effective. And I think that is something that I really have tried very hard over the past couple of years, and, in webinars that I've taught, is that, an algorithm, and when a sclerotherapy patient comes into the practice, consultation is key. So not injecting that patient on first, visit, having, that preparing that history and physical right when they come into the office, asking specific questions. What are your goals? What are your expectations when it comes to us treating your veins? Getting that familial history so that I understand what I'm working with this patient. Asking questions. There's an acronym, HASTI, HASTI, and the H stands for heaviness, A is for achiness, S is swelling, T is throbbing, and I is itching. So if I ask a patient any of those questions, do you experience any of these? And if they say yes to any of them, what I'll do is send them off for a duplex ultrasound. And that will give me an idea of, is this truly a cosmetic patient that I'm going to be working with that I can treat with sclerotherapy and then maybe down the road with the cosmetic laser? Or is there some underlying reflux in a larger vein that's underneath, that's feeding all of these reticular and spider veins, that needs to be treated by a practitioner that can manage, venous insufficiency? And so I tell all of my med spas, dermatology practices, plastic surgeons, hey, make sure that you get out there, meet a physician actually treating the underlying venous disease, establish a relationship, and have them do the duplex ultrasound. So they'll do the underlying disease and then have them send back to you all the cosmetic stuff. So the sclerotherapy, the laser, it's really a win-win situation, because if the vein physician is only doing, most of them really only want to do the underlying disease because it's covered under insurance and Medicare. They don't really care so much about the sclerotherapy or the cosmetic stuff. You can get those patients back, and even some of their patients, you can get them capture them and maybe do some other procedures on them as well, not just the sclerotherapy. So establish a relationship with somebody that knows how to treat underlying disease if it's medically, necessary.
I'm Kathy Christensen, President and CSO of AmSpa. Don't miss Medical Spa Show 2025, April 10th through the 13th at the beautiful Wynn in Vegas. Use code Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. See you there.
Promo code expires on April 10, 2025 at 11:59 p.m. Pacific Standard Time. Promo code only applies to the primary registrant. Promo code cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants. Yeah, no, it seems like there's an opportunity there and almost a symbiotic relationship between a med spa and a physician or practitioner that's treating the vein conditions. And so your recommendation is for them to really kind of form a partnership so that you can focus, if you're a med spa, on the aesthetic side and not necessarily worry about, because the first thing you said is, well, get an ultrasound. I was thinking, insurance was going off in my head, and a lot of med spas aren't really set up to do that. But if they have someone that they have a relationship with, that makes a lot of sense to me. Is that something that you train on, and that you get these folks to, and how do they find somebody if they want to do that?
Yes. I mean, it's so easy. Given where we're at with treating underlying disease, I've been in that world for a long time, and it's pretty impressive, when I have sent a patient off to one of the referring physicians for the underlying disease. It's such an easy procedure. These ablative procedures, it's outpatient. Patient walks out of the practice. That particular procedure takes, about 15 minutes. They're out the door, and then the patient always comes back to me, and we continue moving forward with the cosmetic side.
Yeah, and you mentioned this kind of algorithmic way of kind of approaching the treatment protocol. And you mentioned this before we had jumped on. And I know you touched on it, but what do you mean by that? Are you talking about that's the kind of the 5 things that you're asking? You're really going through a checklist to making sure that there's certain things that you're crossing off. Is it anything beyond that, or is it how difficult it is to learn that process?
Yeah, that's basically the problem. I mean, that's why I started the algorithm process several years ago, because what we were finding is that practitioners and even patients were getting pretty frustrated. When you don't set expectations up with patients, whether it's doing sclerotherapy or other cosmetic procedures, you're letting your practice down and you're letting patients down. Mm-hmm. So if you're doing all of the right things and explaining to the patients, this is why this algorithm is in place, because if you have something underlying and I'm just doing performing sclerotherapy on you, and or doing laser procedures on you, on your veins, and there's something underlying happening here, I'm taking your money and you're not getting a great result. So for both of us, to do the right thing is for me to send you off to somebody else so that the right thing is accomplished. But again, as I stated, I think that's the best way, or I know it's the best way, just in attending conferences and speaking to, the guys that are out there on podium, and they're the ones that manage the underlying disease. I think one of their main frustrations is that, there are practitioners out there that don't understand the disease process. Mm-hmm. And it's like putting Band-Aids on some of these patients and not really managing them properly. Practitioners that don't understand that you got to inject reticular veins first, then spider veins, always inject at highest point of reflux, and then work your way down to the smaller vessels. Mm-hmm. So the algorithm component of this, it is very important for the success of your practice and also for the success of the patient and the efficacy, as you stated, making sure that they're getting a great treatment and they're happy. We want happy patients because happy patients equals, they're going to come back and our reputation remains intact and we become, the person that the patient really trusts.
Yeah. I like, you mentioned one of the questions we're going to get, or someone's going to be wondering about, is kind of the financial aspects of this. A lot of these folks are trying to build a practice. They're trying to build their med spa. And you mentioned, I think, packages, doing like a vein package, which I think was really a really good idea. The sclerotherapy kind of practice by itself, if you're doing that for cosmetic reasons, what is that a profitable practice? Can you make money off? Because the people that's where they go with a lot of this stuff. And I'm just curious what we can tell them about that, because there's going to be questions about that as well.
Mm-hmm. I get that question asked a lot. And I always say, it varies where you're located across the country. I see ranges from $350 a session all the way up to $950. Obviously, the $950 range is, your creme de la creme, La Jolla,
right,
California, San Francisco, Chicago, New York City, some of those cities that, where aesthetic procedures are pretty high. There's a pretty high price tag to them. I'm in the Dallas area, so, I see anywhere from $350 to $550 for, a session that's typically about 30 minutes in length.
Okay. And how many sessions is it more than one session usually, or is it?
Yes.
Okay.
Yes.
So they're going to be coming back.
Yep. I usually tell people, anywhere from 2 to 6 sessions. And if there's that familial history, I've had women that, we're doing maintenance, injections for, years.
Right.
I think it's really important to make sure that, if you've got a patient that's on their feet all day long, whether it's a nurse or a physician, hairstylist, somebody that, or, waiting tables, somebody that is on their feet all day long, wearing compression stockings are really important because it helps to support those vessels in the legs and prevent further veins from showing up.
Just forgot what I was going to ask you. It was a really insightful question too. It's too bad. I'm sure. Well, then I'll move on. I'll think of it in a second. What is I know what it was. Sorry, it just came to me. I knew it would. There's got to be a very, very high demand for these treatments. I've having lived with women my whole life, and I'm married, and as I know, and with not only women but also with men as well, that there's got to be just a massive amount of patient population out there, and the fact that you're able to bring them back for multiple treatments gives you a chance to explain other things that you do, package them with other aesthetic treatments. It seems like a natural, but talk about kind of the market out there. What's the market like for these types of treatments?
It's pretty significant. If you look at just venous disease in general, it's out there. You have over 30 million people out there walking around right now that have just the underlying disease process. So most of those patients have the superficial, issue as well, with the spider veins and the reticular veins showing. So it's a pretty significant population that's running around out there. And, I think that even some of these patients don't realize, and it's just shocking to me because sclerotherapy has been performed for, about a century now. And there's still patients out there that are still unaware as far as what to do about these veins that I can see in my legs.
I was just going to ask that. It probably, when you see them, you're just like, man, you could have taken care of this a long time. So there's a significant population of the patients that just don't know that this treatment is available, and if exposed to it, they're gonna love the results, it seems like.
Absolutely. And putting images, up in the office
Yeah.
listen, I mean, I've been treating veins since 2002. And when I first started, I could not stop looking at people's legs. It's just like,
I'll bet.
it's like,
I'm
I
going to
just
look at
felt
my
like,
legs today. That's for sure.
you are. You're going to go look at your wife's legs and everybody else in the office. You're going to go check
Yep.
them out and go, I know what you can do for that.
I do. Yeah. I love it. That's awesome. Well, this is great. I think this is really interesting. The med spas that you've worked with, have they been really happy with, you come back to them 6 months, a year, a couple of years when they've added these procedures? What's their results? Are they happy with it?
Very happy. And, sclerotherapy is seasonal. So I love it when, med spas fully understand, or even derm practice, whoever is doing sclerotherapy, they understand kind of that time frame of the year to perform these procedures. I basically, I don't like to do treatments in the summer with sclerotherapy. So a lot of the marketing that goes on will be, back to school specials,
Mm-hmm. Mm-hmm.
Halloween, Christmas time, getting everything, trying to get legs prepared, you know,
Mm-hmm.
before the summer months hit when everybody's wearing their shorts. And, those are great ways to, focus on marketing efforts.
Sure.
Because there is the compression stocking component of sclerotherapy, uh, performing these procedures in the fall and in the winter, those are your peak times, because the
Yep.
compliancy and getting the patients to actually wear the compression for about a week,
Mm-hmm.
they'll be more apt to do it, in the colder months as opposed
Yeah.
to the warmer.
They're not going to go out to the beach wearing compression socks. Although maybe we
No.
can make that a thing. You never know. Um,
It's the new style.
that's right. So I'm curious. This is, maybe a little off script. You said you got into doing veins in 2002. What drew you to this particular treatment? How did you get into it? And you've been there for a long time, and now you're obviously one of the recognized experts. You're representing a lot of these FDA cleared manufacturers and distributors. How did you get into it, and what's your story?
Oh my goodness. Back in 2002 is when I started my own med spa. And it was just one of those treatments that I was getting asked, hey, do you do this? And back
Mm-hmm.
then we didn't have a whole lot of, laser options. You had a basic IPL back then, and, you know, KTP was just starting to evolve, and, Indiag was out there, but no one was really treating
Mm-hmm.
veins per se with laser therapy. So I I went and took a course myself, and I learned how to do it, and I picked it up. And I always tell my practitioners when they're first starting, you're either going to love this or hate this, because it's a very fine injection technique. I love it because it's a very
Right.
challenging process to, stick these tiny little veins. And there's excitement when you do get into a vein and you inject them and they quickly disappear and then they come back. There's this ooh ah, the patients get into it. So I mean, it's really fun for me. I get it. I'm addicted to it, and everybody that I've trained over the years, they feel the same way. When they start, injecting and they pick it up, they're like, oh my gosh, I cannot stop. 30 minutes is up, and I want to keep going. So
So they're, and forgive me if you already answered, they're billing kind of by the session
yeah,
in the time limit. So it's not even, okay, we're going to do this until we hit all the veins. It's just because that could take longer, I imagine. So it's just literally time based.
I I like to I like to put a time to it. At
Yeah.
the person that's not getting stuck, it's easy for us to just keep going.
Yeah. Just
Um,
don't stop. Just go till it's all
yeah,
gone.
yeah, and the patient's just like sitting there going, okay, how many more sticks do we have left? And it's 30
Yeah.
minutes later. So I mean, we're talking, sometimes in that 30-minute window, you're doing, quite a few sticks in the
Yeah.
legs. So you just want to be mindful of the patient and how many sticks you're actually, performing on
Yeah.
a leg. It's a lot.
Yeah, yeah. Well, this is awesome. This has been really informative. I appreciate the information. I think again, I love learning about new treatments. I think there's definitely a place for this. And I know that a lot of patients maybe don't know about it. I think there probably are providers out there who are, for whatever reason, they're a little nervous about getting into it. But I think, you've really explained it in a way that makes it approachable. And I feel like it's something that folks should really explore. There's no reason not to. It's another option, another tool in your tool belt. Plus, patients are coming back, which is always a good thing. Getting them to come back, and your ability to offer packages, I think, is great. Any other final thoughts before we sign off? And then I'd love to get some information about where can folks find out more if they want to learn more about this and potentially add it to their practice.
Yeah, I think we've covered it. It's great. Thank you. Yeah, just go to Asclera.com. That's where you can learn more about Asclera. And then,
Okay.
We can always recommend, training courses. And
Yeah.
we've got quite a few webinars that I have hosted over the past couple of years that, from Sclerotherapy 101 to, patient consults, we've got those as well. So, and everything in between, if anybody wants additional education on that.
Yeah, we'll have to talk about doing something, a little more hands-on and visual, adding this to a med spa practice and then doing consults and things like that. Like, people really want to know, they'll want to know how to do it as far as the logistics of it, pricing, timing, all things like that. I think there would be some interest in that. So that's great. I appreciate your time, Keetha, very much for coming. And this is great. And we'll have to have you back and check in.
Thank you so much. I really appreciate it. Thank you. It was fun.
Thank you to producers Madeline Mahler, marketing content coordinator who organizes, schedules, and handles our guests, provides topics, talking points, and guest bios to our hosts. And myself, Jody Guzman, technology operations assistant manager. I handle the audio and video editing, voiceovers, and tech. Kate Harper, digital marketing coordinator who makes all of our graphics and manages the podcast platform. Esme Uriostegui, senior social media coordinator who makes and posts all the clips of the podcast to our social feeds. Our music is by Ghost Score. Thank you for listening to or watching the Medical Spa Insider podcast. Please follow or subscribe wherever you listen to your podcasts and subscribe to our YouTube channel for future episodes. For more information about the American Med Spa Association, please check our show notes or in the description below.